Which of the following is found in prokaryotes and not eukaryotes? A. Plasmids. B. Mitochondria. C. Ribosomes. D. Flagella. Plasmids are found only in prokaryotes. In bacteria, they are transferred either via conjugation, transduction, or transformation. Both prokaryotes and eukaryotes contain ribosomes, however the subunits of eukaryotes are smaller, have a lower sedimentation rate. Both can contain flagella, but they differ in complexity and type of motion. Only eukaryotes contain mitochondria, which is the site of the Krebs cycle, beta oxidation of fatty acids, and electron transport. A bacterium has a generation time of 25 minutes. Starting with a single cell, how many cells are present in 200 minutes? A. 256. B. 8. C. 108. D. 16. The answer is A. 256. This question involves the concept of generation time, which is the time it takes one colony to double. Therefore, there will be 2 cells in 25 minutes, 4 cells in 50 minutes, 8 cells in 75 minutes, 16 in 100 minutes, 32 cells in 125 minutes, 64 cells in 150 minutes, 128 cells in 175 minutes, and 256 cells in 200 minutes. Note that it is very rare for a single bacterium to be isolated, thus a bacterial colony grows exponentially over a short period of time. Note that 200 minutes represents 8 generation times. The number of bacteria, when starting with a single cell, can be calculated as 2n, where n is the number of generation, doubling, times. Here, we have 28 equals 256. Which sterilization method is best for destroying endospores? A. Oven. B. Refrigeration. C. Autoclave. D. Pasteurization. The answer is C. Autoclave. Students should possess the knowledge that the Clostridium genus produces endospores. This fact makes them extremely virulent. Heating alone will not kill the spores. Only heat, accompanied by pressure, will penetrate spores. This method is obtained either by an autoclave or pressure cooker. A synthetic protein is created inside a bacterium from an introduced RNA strand. Which method does the bacterium employ to create the desired protein? A. Translation. B. Transcription. C. Transduction. D. Replication. The answer is A. Translation. It requires the understanding that the process of producing protein from RNA, ribonucleic acid, is termed translation. Replication is the process by which DNA is synthesized from DNA. Transcription precedes translation and involves synthesizing RNA transcripts of specific sections of DNA. Transduction is one way bacteria exchange genetic information. Specifically, transduction involves the transfer of bacterial DNA via bacteriophage. Note that this is one way that a group of bacteria can become resistant to antibiotics without ever having been exposed to the antibiotic to which they are resistant. Pili allow for the movement of genetic material between sister bacteria by a process known as dash, which allows for the passage of A. Transformation. Naked DNA. B. Translation. Protein. C. Transduction. Prophage. D. Conjugation. Plasmid. The answer is D. Conjugation. Plasmid. The question requires the knowledge of pili and that pili are of two types, attachment and conjugation. Conjugation is a way that bacteria become resistant to antibiotics. In this process, a circular piece of deoxyribonucleic acid, DNA, plasmid, is exchanged through a conjugation pellis. Transformation is genetic alteration caused by direct uptake of naked genetic material from a bacteria's surroundings. A prophage is a bacteriophage that has inserted itself in the genome or plasmid of its host via the lyogenic cycle is latent. Transduction is the movement of genetic material due to bacteriophages that digest host DNA and accidentally package it inside their own capsids. These phage then go on to infect other bacteria, and insert the newly borrowed DNA into the new host cell's genome, plasmids. Translation is the process in which RNA, ribonucleic acid, is converted to protein. A tuberculosis skin test is given to a patient who is severely immunocompromised with a low CD4+ cell count. This test is considered positive if it is greater than A. 10 cm. B. 5 mm. C. 1 cm. D. 5 cm. E. 10 mm. The answer is B. 5 mm. The TB skin test has different thresholds for positive values based on the size of induration. In an HIV-positive individual, low CD4+, immunocompromised, a test is considered positive if it is greater than 5 mm. A positive result takes 24 to 48 hours to reveal itself. The MANTA test or Mendel-Manta test, also known as the MANTA screening test, tuberculin sensitivity test, PRK test, or PPD test for purified protein derivative, is a tool for screening for tuberculosis, TB, and for tuberculosis diagnosis. A standard dose of 5 tuberculin units, Tu-0.1 ml, according to the CDC or 2 Tu of Sten's Serum Institute, SSI, tuberculin RT23 in 0.1 ml solution, according to the NHS, is injected intradermally, between the layers of dermis, and read 48 to 72 hours later. This intradermal injection is termed the MANTA technique. A person who has been exposed to the bacteria is expected to mount an immune response in the skin containing the bacterial proteins. The response is a classical example of delayed type hypersensitivity reaction, DTH, a type 4 of hypersensitivities. T cells and myeloid cells are attracted to the site of reaction in the time frame of 1-3 days and generate local inflammation. The reaction is read by measuring the diameter of induration, palpable raised, hardened area, across the forearm, perpendicular to the long axis, in millimeters. If there is no induration, the result should be recorded as 0 millimeters. Erythema, redness, should not be measured. What is an infectious cause of orchitis? A. Chlamydia. B. Measles. C. Epstein-Barr virus. D. Mumps. The answer is D. Mumps. Mumps is a viral disease caused by the mumps virus, a paramyxovirus. Orchitis due to mumps has decreased significantly due to vaccination, but it is still a significant risk in unvaccinated individuals. Mumps-related orchitis can result in testicular failure later in life. None of the other microbial infections listed have an association with orchitis. Hepatitis C is associated with higher levels of what metabolic disorder? A. Fabry disease. B. Type 2 diabetes. C. Gaucher's disease. D. Wasting syndrome. The answer is B. Type 2 diabetes. Individuals with hepatitis C have a much higher incidence of development of type 2 diabetes. This is thought to be due to increased levels of tumor necrosis factor, TNF-alpha, which leads to insulin resistance. Gaucher's disease is a hereditary disorder of glucosylceramide accumulation that can affect the liver but is not caused by hepatitis C virus. Wasting syndrome is a general term for individuals who experience unintentional weight loss due to a disease such as cancer. Fabry disease is a rare liposomal storage disorder unrelated to any viral infection. A child appears with a flat pink rash that first appeared on the trunk. Subsequently, the rash migrated to the rest of the body. Which of the following is the most likely cause? A. Smallpox. B. Measles. C. Rubella. D. Chickenpox. The answer is C. Rubella. Measles is a highly contagious infectious disease caused by measles virus. Measles begins with Koplik's spot in the mouth. Then the rash first appears on the forehead. Rubella first appears on the trunk, then spreads throughout the body. Chickenpox manifests as fluid-filled vesicles. Smallpox appears as blister-like lesions, and this disease has been eradicated for a few decades. Which strain of human papillomavirus, HPV, is associated with the most forms of cancer? A. 16. B. 18. C. 6. D. 11. The answer is A. 16. While HPV-18 is associated with a large percentage of cervical dysplasia alongside HPV-16, HPV-16 is the strain associated with the majority of HPV-related anal cancer, cancer of the throat, tongue cancer, vaginal cancer, vulvar cancer, and penile cancer.